You've just been diagnosed with diabetes and you want to know what this means. Well, diabetes is sometimes also referred to as sugar diabetes. So, what is sugar? Well, sugar is the carbohydrates in our diet, the carbohydrates or the glucose that our body makes. So, sugar is just not the sugar that you eat. That is one form of carbohydrates. Apples have sugar, bananas have sugar. These are all carbohydrates. Bread has sugar. That's a carbohydrate. Cakes have sugar. That's a carbohydrate. So you have to think about carbohydrates as sugar. So what does diabetes mean? Diabetes today, the way we define diabetes, means that your blood sugar levels or your blood glucose levels, they're often used interchangeably, have reached a number which is increasing the risk for complications of diabetes over time. Those complications are damage to the eyes, damage to the nerves, damage to the kidneys, potentially also increasing the risk for heart attacks and stroke. That's how we're making a diagnosis of diabetes, based on the risk increase of long-term complications. That's one way to look at diabetes, and one way to treat diabetes is to reduce that risk of long-term complications. Nobody wants to lose a leg, nobody wants to lose their kidneys, nobody wants to go blind, nobody wants to have a heart attack or a stroke. So one way to treat diabetes, or one reason to treat diabetes, is to reduce that risk. Now let's look at it on a different perspective. Let's look at it from a day-to-day perspective. Sugar is the main source of energy for your body. Anybody who's had children knows not to give them sugar in the evening because they're going to be bouncing off of the walls, because that sugar is converted into energy, and that's how we function. So if we think about it that way, we say, how do I take care of my sugars? Because if I take care of my sugars on a day-to-day basis, I'm going to feel great. I'm going to have all the energy that I need. And over time, over 4 or 5 years, I will not get the complications of diabetes. So let's start thinking about it from this perspective. How do I take care of my sugars on a day-to-day basis? In order to understand this, I think if you can visualize a blood vessel and say, okay, in this blood vessel, say it's a vein, it's an artery, there's a certain amount of sugar. This is the sugar that's giving me energy. So if I keep this sugar normal, so what's normal? Well, normal is less than 100 before you eat, less than 140 after you eat, 2 hours after you eat. But we make a diagnosis of diabetes at a blood sugar of 126. That's a bizarre number, right? 126. Well, the reason it's at 126 is because that equates or is equal to the international way of looking at diabetes in millimoles. That is 7 millimoles. That equals 126 milligrams, which is how we measure it in the United States. So at that point, your risk, if your fasting glucose or fasting sugar is higher than 126, your risk for long-term complications is going up. But remember what I said, on a day-to-day basis, if your blood sugar is running at that number, you're not utilizing sugar efficiently for energy, therefore you don't feel good. So in order to utilize sugar for energy, we need to give you some medications and you need to make some lifestyle changes. Some of these medications will allow the sugar to be utilized. Some of the medications will allow you to eat less. Some of the medications will allow you to make less sugar in your body. So how does all of this come together? So let's go back to that blood vessel. Let's look at the blood vessel. This has got some amount of sugar in it. The amount of sugar in the blood vessel is determined by the rate at which it is appearing into that blood vessel, balanced by the rate at which it is disappearing from the blood vessel. If these two rates are equal, then your sugar is normal, and you're utilizing that for energy, and you will not have long-term complications of diabetes. So let's break this down. The rate of appearance, what determines the way the sugar is appearing in the body? One of the key determinants, one of the key reasons for having sugar in your body or how sugar gets into your body is what you put into it. So that's the carbohydrates that you consume. So if you eat less carbohydrates, you will have less sugar going into your body. But carbohydrates, as we mentioned, are sugar. Remember, I'm using carbohydrates, sugar, and glucose all interchangeably. Carbohydrates are the main source of energy, so you have to eat those carbohydrates, but in moderation. So when you go to see your diabetes educator, they're going to ask you to moderate those carbohydrates. They're going to tell you how much you need to eat, how much you need. Now, when you consume those carbohydrates in the right proportion, you need to get those converted into energy. In order to convert those into energy, you need a hormone called insulin. That is the key determinant of the rate of disappearance. So you eat those carbohydrates, your body kicks out certain amounts of insulin. This insulin is like a key. It unlocks the door in the muscles, which allows those carbohydrates or those sugars to be taken up by the muscles and burnt into energy. Once you have the right amount of energy produced, the body stops making insulin for that meal, and the sugar remains where it is. Come the next meal, the same process repeats itself. So that's what is happening. In your case, you're either consuming too much or you're not able to utilize that well, and therefore you have diabetes. Now, when you're not utilizing the sugar for energy, your body is saying, I need glucose, because it thinks you're hungry. So that brings about the hunger of diabetes. Now, if your sugar is not being utilized, your body says, I need to get rid of it some other way because it's not being converted into energy. So you start peeing a lot. That brings about the increase in urination with diabetes, where you need to go to the bathroom all the time. But as you're peeing it all out, you're taking with it a lot of water. That brings in the thirst, because your body wants to replace the water. That brings in the third element of diabetes. You're hungry all the time, you're peeing all the time, and you're thirsty all the time. Along with this, you're not utilizing sugar for energy. Therefore, you're tired all the time. So in order to fix this, you have to reduce the amount of sugar coming into the body, and you have to allow it to be converted into energy more efficiently. That's where your doctor comes in. Now, added to all of this, there's another element. We are not eating all the time. Well, at least some of us are not eating all the time. So what happens between meals? Between meals also, our body needs a source of energy. And that source of energy also comes from sugar or glucose, which our body is making. There's an organ in the body, usually on the right side of the body, called the liver. That's kicking out glucose all the time between meals. Turns out that when you are having diabetes, when you have a condition where you cannot utilize sugar for energy purposes, your body is thinking it needs to make more sugar, even though you can't utilize it. So your liver is kicking out a lot of sugar. So there are certain medications that your doctor might give you for that too. So if we want to summarize this for diabetes, the amount of sugar in your body, if it's too high, on a day-to-day basis, you're not utilizing sugar for energy. Over long term, the sugar is harmful to you, and you can get all the damage that diabetes causes. In order to treat diabetes, you want to make sure that the sugar is being utilized for energy on an ongoing basis. What you're consuming needs to be converted into energy, for which your doctor is going to give you some medications. Plus, you can consume a little bit less. What your body is making needs also to be stopped, which could be stopped by giving you certain medications, and in some instances by losing weight, you could make less sugar in the body. And all of this together is necessary to take care of diabetes.